Bowden, have been working with the Machinists Union for the last 5 years in our retiree assistance programs, helping educate seniors about geriatric health issues of all kinds. They are both nurses, doctoral level training of nurses at Metro Health Systems in Cleveland. Most importantly, Cheryl Braddis is the daughter of ex-business representative Larry Karpowitz, and Vicki Bowden is his adopted daughter. So they are already part of the family, so please welcome first Cheryl Braddis.
We're looking around, and I Ron and Joe and Mary. And I said, it always reminded me, do you remember Romper Room? It reminded me of Romper Room, like all the different people we see. So thank you for having us. We love coming here. We always have great discussions. Normally we talk about these two topics for about 2.5 or 3 hours, and today we're condensed down to 1 hour. So I'd say buckle up. It's going to be a fast ride. We have to move quick. But when we're done, if you have any questions, please feel free to leave it out, and we'll be happy to answer anything for you. So we're going to talk about falls, and because it's such a serious issue. A lot of serious injuries occur, and it's a huge healthcare expense. And part of that really comes from that in 2011, I move around so much, sorry. I'm not used to being contained. In 2011, 11,000 people a day start turning 65 and older. So the baby boomers, 1946 to 1964. And with the Affordable Health Care Act, there is a huge focus on prevention. And so with so many people becoming older and so many falls occurring in older adults, that's why we're trying to focus on prevention. So you can see that 1 in 3 older adults in the community will fall. That's a lot. And 1 in 5 result in really serious injury. When we're talking about serious injury, we mean like hip fractures, traumatic brain injury. Sometimes people fall at home and they're found down. So sometimes they're not found down for hours or even days. And the longer they're on the floor, the more significant injuries they have and the poorer their outcomes are, because they end up with a lot of system failure from different organs. Think about people that you know have. Has anybody in here fallen? How many people in here fallen just by show of hands? So just look at that. What about anybody in here, yourself or somebody you know, suffer a hip fracture from a fall? See? Look around. What about a head injury? You see a lot of hands go up. So if you can't see all around the room, I've seen a lot of hands go up around the room for those types of injuries. And a hip fracture, that's a serious injury in an older adult. One in 5 will die within the first year. Another 1 in 5 will end up in long-term care. Another 1 in 5 will have to go to skilled care, and then they can come home, but they never quite their baseline status. Another 1 in 5 will come home, and they do well, but may not, again, be back to where they started. And another 1 in 5 will do well overall. A lot of that really depends on how many underlying problems they had to begin with and what their functional status was to begin with, how well they can get around. So we really want to focus on things, what are the risk factors, and what can you do to prevent some of those things from happening so you don't fall and sustain an injury. You can see that if someone gets admitted to the hospital, the average cost of a fall is approximately $35,000. That's a lot of money. And that the direct medical costs are $34 billion. So direct medical costs mean direct in terms of care required, whether it's in the hospital or long-term care, follow-up visits with doctors, things like that. And then there's also indirect care, indirect costs. And that has to do with quality of life. And ability to participate and function in different types of things before. So close to 2020, about $55 billion annually will be just put into cost of falls. So again, this is where we're trying to focus on fall prevention. It's not uncommon for older adults to actually develop a fear of falling, either from a fall, so it could be a consequence of a fall, which is also a future risk factor for another fall to occur, or because they know somebody that something really traumatic has happened from a fall, like a brain injury or hip fracture, and then they develop a fear of falling. So with that, people put self-imposed activity restrictions on themselves. And the more they don't want to move around, the more risk they become for actually having a fall. So really, most falls are due to multiple interactions. Both of our parents have fallen, both of them have sustained injuries. And so even everywhere we go now, we're looking at just the environment, the surfaces, the bathrooms. And so really, in the bathroom, we're going to talk about that later. Think about the bathrooms here and what you've seen in the bathrooms. Right away, as we walk into bathrooms, we identify what the risks are and things that they could do to actually improve it and make it safer. Actually, I saw someone here trip this morning over a bag that was in the way. So think about that as your bags, keep them closed in. So falls really occur due to multiple different factors. It's not just one thing in and of itself. So we typically think of internal risk factors, external risk factors, and situational. So when we talk about internal risk factors, think of things like muscle weakness. So conditions that can cause muscle weakness. Someone may have MS. They may have had a stroke. They may have diabetes and have some neuropathy or decreased sensation in their feet. They might just have overall weakness because they're not moving around as much. A history of fall. If someone has fallen before, they're definitely at a higher risk of falling again. And that fear of falling that we talked about before, that is highest within the first 6 months after a fall. It can tend to dissipate, go down over time after that. But if someone's in that similar situation, that can happen again. And with the fear of falling, people will change their gait and their stance and how they walk and how they move. So while it's a protective mechanism, it's also a red flag to us that if someone's holding onto furniture or really trying to balance themselves, we know, one, that they're afraid of falling, and two, we need to do something to try to help them so they don't fall. And then gait deficits. And so again, here we may see this, all kinds of different things. People, again, may have had a stroke, they may have had Parkinson's, where they have more of a shuffling type of gait or stop in the middle of their tracks. They may have a drop foot from an injury or from another type of illness. Visual and hearing deficits. So even think about, for those of you who have glasses, when you don't have your glasses on, it makes it much harder to interpret your environment. Or when you don't have the ability to hear correctly, then a lot of times it's hard to understand what someone's trying to say. And my dad just got his hearing aids. And it's, I'm telling him something. We have two completely different dictionaries, trust me. We're having two conversations the whole time we're in the house. And I said, Dad, but where's your hearing aids? He said, I don't think I really want to wear them now. So then he'll take them out, and we're still having two different conversations in the house, but he's trying to get used to them. And then when it says here impaired ADL, that means activities of daily living. So just being able to go about and function and do things that you need to do on a daily basis. And being able to care for yourself. So if there's any impairment in that for sure will put people at higher risk for falling. Illness and medications. I just want to talk about this for 1 second. How many medications do you think that the older adult is typically on?
7, 8.
10 to 15. Yeah, and that's a really good number. And when I think of older adults, typically that means 65 and older, but people will generally tell you that they think older is at least 25 years older than they are. So it's all relative. So my father-in-law was going to a discount casket store, got pulled over because he did a U-turn where he wasn't supposed to do, after he was drinking his homemade wine, and the police officer pulled him over, so of course he got a ticket. He wanted to fight it. He went to court, and he told me, oh, the bailiff was so old, he must have been 80. And I'm thinking, you're 82. So, it's all relative to what you think old is. But typically when we talk older, we're talking 65. So yes, older adults are typically on approximately 10 medications. And when there's 4 or more, you have to really worry about interactions between different types of medications. Sometimes somebody may go home on pain medicine, say something like Percocet. They might have had an injury. And then they don't realize, or they just don't remember sometimes that contains Tylenol. Then they're taking other Tylenol over-the-counter medications. And so things can begin to interact and have bad side effects. So sometimes people are falling from a result of medications or the interactions. With depression, why would depression put somebody at risk for a fall? They could be on medication. They're lethargic. So, a lot of times people who are depressed, they tend to sleep more often. They're not engaged. They tend to kind of separate themselves, and they don't have a lot of passion for life at the moment. They're really depressed. And to treat someone for clinical depression could definitely impact quality of life. But the more time that they spend kind of sitting around, lying around, the greater they have a chance of becoming weak and decline occurring. And so this is what we see with those hip fractures. When I talk about 1 in 5 people will die within the first year, they begin this downward spiral. They develop pneumonia and blood clots and pressure ulcers and different types of things occur. And so this is why we try to get people engaged as quick as possible. Plus, we send patients home as patients. I mean, we used to keep patients in the hospital for a long, long time. And now, has anybody had heart surgery recently? How long did you stay in the hospital? 3 days. Yep, average length of stay for heart surgery, for open heart surgery now is approximately 3 days, barring there's no complications. I mean, and just think how long we used to keep people in the hospital for. So we're sending patients home as patients, still sick, still weak, and not recovered yet. So people in the home then are now also becoming informal caregivers, and they weren't even ready for that at that point. And then, of course, people have underlying cognitive impairment. So sometimes before dementia is actually diagnosed, people may begin with what we call early mild cognitive impairment. So they can answer the who, the what, the where, the when, but it's harder for them to make connections. You'll see lack of insight, judgment, poor decision making. Think about, in Ohio, we have these signs across the highway. It'll tell us 7 minutes to I-71. But now it also says missing adult, license plate number, and there's such variation about license renewal. And so in Ohio, we can give it to anybody. We just keep giving it and giving it and giving it. Where in other states, they look at cognition, part of age at 65 and part at 85, so it just depends by state. This is one picture I wanted to really show you guys. This is an aging brain. So you can see a 27-year-old brain versus a 87-year-old brain. There's some normal atrophy that occurs in the brain or shrinkage of the brain over time. That's natural. That naturally occurs. But if a person falls and hits their head, this is where we really want to make sure that they follow up and see a doctor. There are a lot of older adults that are on blood thinners of some type. And even baby aspirin. Sometimes people take baby aspirin almost like it's an M&M. And they don't even think of it in terms of a blood thinner because it's not like Coumadin or another type of prescribed medication per se. But if an older adult falls and hits their head, you see this 87-year-old brain where there's much more room. That means the brain can expand and swell, or blood can develop and expand in the brain to a much greater degree before the patient becomes symptomatic or shows symptoms. Where in the 27-year-old brain, you'll see that those symptoms sooner because the skull is more tight. So for an older adult, if they fall and hit their head and they're on any type of blood thinner, they need to really see the doctor right away because sometimes symptoms may not show up for 24 or 48 hours because of that. So just sort of keep that one in mind. Just some normal visual changes that occur with aging. The pupil itself shrinks in size. The lens becomes less elastic. There's less accommodation to changing from distance and looking up close, and to decreased light sensitivity. And so that really all makes the difference in terms of even going to the bathroom in the middle of the night. I think people do pretty well on the way to the bathroom. They flick on the light. Right, you have those bright lights in your eye, they shut the light off. Most falls occur on the way back to the bathroom. So we're going to talk about some things for that. There's also some age-related eye changes that occur with time. It's not normal part of aging, but it's not uncommon for them to occur. So you can see the difference in some of these. A cataract is kind of like an overall blurred vision. A macular degeneration is loss of central vision. And a glaucoma is loss of peripheral vision, at least initially, before it becomes even more advanced. But you can see how with normal age-related changes in the eyes and some of these common age-related diseases, how that could definitely impact a person's vision or visual field. This is a concept called visual clipping, and we definitely see this a lot. So you see how there's that black stripe in the white floor? How do you think that that is seen sometimes? Right, some people see it as a step up, some people see it as a step down, some people see it as a depth. It's like sitting in a chair that you think is too high or too low. And so just sometimes letting know somebody that there's going to be a change, that there's not a change in the surface, that it's actually a flat surface, regardless of that contrast. That could be really helpful. My mom almost fell at Playhouse Square the other day because there was a sharp change in the contrast like that, and she caught the railing, and I caught her from behind. But that's like another key thing to see. Definitely changes in bone mass and bone density. When do you think you begin to lose bone mass? What age? Close, about 30. You begin to lose bone mass about 30. And so we really want to stress the importance of vitamin D and calcium supplementation. And because once you lose it, it's definitely much harder to get back. And we see a lot of the most devastating injuries for people who have osteoporosis or have that loss of bone mass. A lot of that other stuff we talked about. We'll talk about external risk factors here quickly. Poor lighting, for sure. That's definitely a major issue. Or cluttered pathways. Stairs, we notice these things a lot too. So sometimes stairs, there's either a high distance between the top step and the next step, or they're almost too close together, or the edges aren't marked. So it's hard for people sometimes to see, especially if you have bifocals on and you're trying to judge that distance between the top and the bottom. It's hard for them to see the edge of a step, and that's another risk, a big risk for a fall. Definitely any furniture on wheels and cluttered pathways. This is Vicki. She fell on the ice twice at work last year, and got a concussion once. Fell also in a hospital bathtub and had what we call a deep tissue injury, which is a really significant injury deep underneath the top surface of the skin. So, falls can recur regardless of age.
And I don't drink.
At least not all the time. And then definitely reaching forward. There's also a change in what we call proprioception or person center of gravity as they age. So this is why in the fall we see a lot more falls in older adults who are doing things like cleaning the gutters, trimming trees. They're up on the ladder. My father-in-law's classic for this. He was up again on the ladder when he was at our house. You're pulling things out, pulling the leaves out of the gutter, and you could lose your sense of balance. And we see a lot of falls in the fall.
You want an example?
Yeah, a lot of falls in the fall. And so we're going to just quickly try to go over some strategies to reduce some falls. Overall, pretty much exercise and balance training, assistive devices, visual correction, medication review, lighting, and the home safety checklist. Can you see what's going on here? I had to look at this for a couple minutes. I couldn't even barely get what's happening. Her leg is literally straight up in the air. So this is definitely flexibility and balance training. This obviously didn't just start brand new. She's been doing this for a while. I could never lift my leg that high.
No. I do that all the time.
Use it or lose it. And we always say, don't think you have to go out and walk a mile. Start with simple things in the chair. This is Maxine. We love her. And we got a lot of Maxine from Susan, so we'll have to thank her for that. She sent us a lot of them. This is Maxine's version of exercise. She says, I find that exercise helps me relieve stress. I start with a few butt kicks, then some little finger lifts. After that, I wind up with some moving for speed and accuracy. So some version of exercise is good. And then we'll just kind of go quickly by the rooms. These are cane holders. This seems like such a simple thing, but this is really a great adaptive device. And when we show you these things, we do not have any vested interest in anything. These are things that we have just found to be useful, either from what we've seen in our own practice or what people have shared with us as we talk to different groups. These are really helpful, mostly like in the kitchen or in the bathroom places that people tend to set their cane, because what happens? They set their cane down, cane falls over. Your head's heavy. Your head's about 5 pounds. They go to bend over, pick up the cane, they lose their center of gravity, and they fall and hit their head. So just a really inexpensive thing. You could even get these on Amazon. They're generally like about $8. And it's just a simple thing to hold the cane, but it'll make a big difference in terms of ease of comfort. Lighting, that's another one. We want to have more lighting for older adults, but at the same time we don't want to create glare, because there is a loss of luminance, or, like I said, the decreased elasticity in the eye and the narrowing of the lens of the pupil. And so we need more light to be able to see, but at the same time you don't want to create glare. For someone who has glaucoma or that loss of central vision I showed you before, when lights are very bright, it could create even a sharper contrast. So around 100 is probably a good amount. I mean, maybe up to 150 if they don't have any other visual impairment. So night lights are definitely a great alternative.
Have you tried some of these new LED lights?
And what are your thoughts about LED lights?
All depends on if you get the sunlight one or the they're light or soft light.
Mm-hmm.
If you get the sunlight ones, it creates shadow. But the soft lights are great and they're very cost effective. You get 100 watts of power of light for only 20 of light.
Yeah, that's true. Everybody hear what he said? He's talking about the LED versus the soft light. And it is true, the soft lights are much more effective in terms of not creating that glare, where the sunlight ones can create a lot of glare. So it is one thing just to pay attention to as you grab that light, off the shelf. And then night lights. Night lights are a really helpful thing. We have applied for little grants at the hospital where we give out night lights to older adults just so they don't have that issue with that light accommodation as they're coming back from the bathroom in the middle of the night. And, again, another inexpensive way to try to maintain safety. So floors,
There's something new, probably not new for everybody. Motion sensor lights
Yeah.
will be inside of the house, so you don't have to touch anything. You get out of the room, it goes off automatically.
yeah, and those are perfect. So he was talking about motion sensor lights. And those are truthfully the most ideal ones. I mean, those are a great one. And even the old clapper. I mean, really, so if someone gets up and just even claps on a light, those are simple things that can really make a huge difference. Okay, so floors, throw rugs. Those can be really dangerous things. We see a lot of bad falls occur with throw rugs. People are basically sliding on them almost like a skateboard and end up literally like on their back hitting their head. So if you have to go baby steps with people, trying to help them decrease some of the risk factors in their house, because it's not going to be all of a sudden you're going to go in and change everything. That will not work. It's going to have to be definitely in terms of baby steps. At least if nothing else, try to get the backing on the bottom of the floor that kind of holds it in place initially, and then you can slowly work down. And you see a lot of small objects in the way. So like I said, I saw someone trip over like a bag that was a little bit out from underneath their chair. You see a lot of falls over grandkids' toys, over animals in the house, things like that. And so for an older adult, truthfully, a very little dog usually is not a good choice because they get wrapped around their legs or tripping over the smaller dogs. Not that you want a big, huge St. Bernard, but, a medium-sized dog. The kitchen, we try to tell people to bring things down that you're going to use most often within arm's reach instead of trying to reach up and again, bending back and losing their sense of balance. And then if you have a step stool, if you do use a step stool, get ones that have handles on the side so you can stabilize yourself as you begin to step up. The bathroom. This is a really dangerous place. We have a lot of really bad falls that happen in the bathroom. Lots of, head injuries and definitely lots of broken bones that happen in the bathroom. It's wet, it's shiny, and there's a lot of hard surfaces. So again, think about the bathrooms that you saw here today. People a lot of times want high tubs with jets and everything, but really you need a low tub and a high toilet. And then in the bathroom, so you can see some of the things in here. They have a new stool to get in now, which actually has the legs on the outside, so you can sit down on the outside, then pull your legs in, and then you're in there instead of trying to climb over and then sit down. Also, shower heads, grab bars. Grab bars really need to be put on and placed at an angle, not straight. So sometimes you'll see them placed straight, and they really shouldn't be placed like that, because when you're sitting down or going to hold on, you are going to be pulling yourself up this way versus trying to push up. A lot of older adults have had issues with shoulder injuries or just wear and tear over time, and that creates much more pain to the stomach trying to push up than to pull yourself naturally in this direction. And then definitely the strips on the bottom of the tub. Do you have them on yours? I do not. I'm here in the hotel.
So I actually have a handicap bathroom.
Oh.
They must know that I make a habit of falling. And it's funny because the tub is actually very high versus being lower. And my fear was that the shower head was going to fall on me. It's a detachable shower head. But it was funny when I saw the handicap bathroom. I said, man, the word must be out.
So really there are a lot of adaptations that can be done in the bathroom before you get into a whole swing door tub, and those are expensive. And not that those aren't a good thing for the right people, but everybody can't afford that initially up front. So just trying to find afford simple modifications that will make a huge difference in terms of safety. Oh, the other thing. Oh, go ahead.
I just want to mention another really